Medawalin Ani. My name is Gertie Mai Muise and I'm Mi'Kmaq from the west coast of Newfoundland. I belong to the Qualipu First Nation. I've been living and working in Ontario for about 25 years, and over the last 10 years I have been working with the Aboriginal Health Access Centres and the Aboriginal Community Health Centres. We now know that Indigenous specific racism within the healthcare system causes incredible harm to the Indigenous population, not just in how we are able to access care, but in how we become diagnosed. And there's a lot of premature death and dying as a result of systemic racism. Although most of our efforts in raising cultural safety in healthcare has been really focused on mainstream health service organizations like hospitals, the emergency departments there, mental health institutions, places where we know Indigenous people come into most harm in the healthcare system. Even though that work is important, because we have models that are intended to provide safe places for Indigenous people to come for care, we have an increased responsibility to ensure that our service spaces are culturally relevant and culturally safe. This article really helps to examine the level of diversity across our healthcare providers that are Indigenous governed. It helps to look at the diversity within the Indigenous populations that we serve, but also in the professional diversity. So Indigenous leaders, Indigenous health leaders and clinical leaders would benefit from this article, as would our traditional healers and the leaders in our traditional healing spaces. I hope you enjoyed the article. Wellbeing.